I'm Dr. Deepak Raj Singh. Welcome to this educational tutorial of Budhamari Center. As we have already pointed out in the last tutorial, that the primary job of health provider is to manage the patient. Today we will delve upon management of the patient.
Management of a patient entails diagnosis and treatment. For proper patient management, we need to understand the aim and modality of diagnosis as well as aim and modality of treatment. Aim of diagnosis is threefold. We need not only to find out the condition of the patient, but the cause of that condition as well as any complications resulting from it. Aim of treatment is fivefold, namely promotive, preventive, curative, palliative, and rehabilitative. Time-honored modality of diagnosis are detailed history, thorough examination, and appropriate investigation. Modality of treatment can either be non-invasive or invasive or both. History includes particulars of the patient, presentation of the patient and history proper as such. Particulars of the patient will include the name, age, and sex plus the address of the patient. Patients may present in three ways: without any symptoms as a patient with COVID-19, with typical symptoms of fever and cough, or with complications as acute respiratory distress syndrome or multiple organ dysfunction syndromes. Detailed history will include present and past and personal history as well as relevant family and environmental history. Examination is trying to find the condition, cause and complication by means of primary tools which are our sense of sight, hearing, and touch, occasionally smell and rarely taste. Secondary tools of examination are stethoscope and now increasingly sonoscope. We at Buddha MAI believe that all healthcare providers should be comfortable with sonoscopy and provide training in sonoscopy to all interested. Examination technique include inspection making use of our sense of sight, palpation relying on our sense of touch, and percussion and auscultation rely on our sense of hearing. Sonoscopy is an extension of inspection called sono-inspection. Finally, we resort to some special maneuvers, more so in orthopedic examinations. Examination sequence should first make sure that the patient is stable and not displaying any early warning signs that may lead to deterioration of the condition as noted by hemodynamic, respiratory, neurological, renal and temperature parameters, which are rightly called as vitals. General examination is then performed by making a general impression and noting if patient displays any abnormal facies like hypothyroidism, Down syndrome. We make note of the hydration and nutrition status of the patient. Look for color change as yellowish in jaundice, bluish in cyanosis, paleness in anemia. Look for skin changes, hair distribution, nail and nail bed changes as in clubbing, koilonychia. Finally, palpate for lymph nodes. Specific examination could either be systemic as cardiovascular, neurological examination as in medicine, or regional as examination of the abdomen or limbs as in surgery. Investigation too are broadly of 5 categories, namely laboratory, where samples are sent to pathology department, imaging to the radiology department, electromechanical to respective medical department, endoscopic and for tissue diagnosis to the surgeon. When sending for imaging, think ultrasound first because it is cheap, repeatable without side effects, and provides a wealth of information. Other imaging investigations are X-ray, CT scan, MRI and nuclear scan. There are a myriad of investigations looking at the electrical phenomenon as ECG and mechanical phenomenon as pulmonary function test. Endoscopy is viewing the internal structure by passing a scope through any natural orifice such as through gastrointestinal tract as upper or lower GI endoscopy, through respiratory tract as in bronchoscopy, through urogenital tract as in cystoscopy or hysteroscopy. Finally, we can ask for a tissue diagnosis, which can either be cytology, examination of cells, or histology, in which tissue is examined. Modality of treatment are basically non-invasive and invasive. Non-invasive is the preferred form of treatment in which psychological or counseling should always be taken into account. Other form of non-invasive treatment is based on natural science, that is physical as in radiotherapy, chemical as in drugs, biological may be the holy grail of treatment with biologicals, stem cells, and gene editing in the horizon. Though non-invasive treatment is preferred, we may need to resort to invasive treatment wherein minimally invasive intervention is preferred to maximally invasive intervention, that is classical surgery. Minimally invasive intervention includes percutaneous, endoscopic, endovascular and portoscopic interventions. Portoscopy is a word that we have coined to include intervention through artificial opening called port, as in laparoscopy, thoracoscopy, or arthroscopy. If one Googles portoscopy, Google asks, do you mean proctoscopy? No Google, no. Notes stand for natural orifice transluminal endoscopic surgery. Promotive treatment means making your health better than what it is at present. At Buddha MAI we prefer Yoga Chi as form of exercise to promote health because it can be done anywhere, anytime by anybody at no cost. We will post a tutorial on Yoga Chi. Chemical promotion means balanced and health diet. Biological promotion in the form of gene editing through CRISPR is in the horizon. Preventive treatment implies not allowing specific disease to occur, like resorting to lockdown and wearing a mask to prevent COVID-19. Vaccine would be a form of preventive treatment. Angela Jones underwent mastectomy to avoid breast cancer. Curative treatment is what we aim for, but unfortunately it is not always possible. Quite too often we can only offer symptomatic treatment, as for COVID-19 as of now. If a disease has set in and we cannot revert it, we can offer rehabilitative treatment so that the patient copes with the disease.
We at Budhamai are committed to education, and these online tutorials are part of that commitment. Any suggestions to improve the tutorials are most welcome. Bye bye for now.